Welcome to my YouTube channel again, Future Nurses, and I'm glad that you're back. And for today, we are going to start a new video lecture series, which is about communicable and infectious diseases. And before I start, I thank you for following this YouTube channel, and this will be a great help for you students. Especially in your studies, in your reviews later, or additional resource. So I'm referring my YouTube channel as a additional resource for students and for those people who are interested or curious about our topics or certain topic. But I highly suggest that you still read books, more and more books, um, listen to your teachers, take down notes. Okay, again, this is only an additional resource. And what says, there are things that your teacher might have mentioned in her lectures which I cannot hear or I may not. So that's one of the reasons why you need to have many resources. Just like one author of a book may mention this and other book may not mention this. Okay, so I really intend my channel to be an additional resource. Okay? And I really highly suggest that you still read books, listen to your teachers, take down notes during lectures, and continue to persevere, to be patient, to study hard and smart, and organize yourself while you go through the journey of becoming a future nurse. And let me share a prayer first before I start this video lecture series. Lord, again, we are thankful to you, Lord, thankful for the countless blessings and graces you have showered upon us each and every day. Thank you for the protection that you're giving us, for the direction, for our families, for our friends, loved ones. Thank you, Lord, um, for these students, for these people who are watching on my YouTube channel. Thank you for them, Lord. Thank you that you are using me to give additional knowledge on what they already have, and please continue to use me as their additional resource. And later on, Lord, please use these future nurses to be your instruments of love, compassion, mercy, and healing, Lord. I pray, Lord, and declare under your name and your will that they will become nurses of this country, of this world, at the right time. And Lord, we lift everything to you, our ups and downs, our joys, happiness, anxieties, and fears, Lord. And we believe that you are forever present with us. This we pray in Jesus' name. Amen. So, um, let's formally start this video lecture series. So, our topic for this video lecture series is um, oh, please do not forget to subscribe for and give yourself notifications for new topics later on related to nursing and education. Whatever topic it is, whatever year level you are, I'll try to give more and more topics. And if ever there will be updates, I intend to make a new video of it and maybe put a word that signifies it is a new version of a certain topic. Okay, so we need to be updated also. And maybe if a video is already out, you know, there will become there will be new knowledge again. And so subscribe, notify, share, like, and thank you so much. Okay, so let's start. So again, our topic is on communicable and infectious diseases. Okay, so when we say communicable disease or diseases, this is an illness due to infectious agent or its product, which is transmitted directly or indirectly to all person or a group or to an individual or an animal or through an agent of an intermediate animal host, vector of the inanimate environment or inanimate objects. Okay, and when you say this disease, okay, as your fundamentals will tell you, this is a sort of disturbance in the normal life, dysfunction phase or state in your normal lifespan, and this dysfunctioning uh, disturbance in the normal lifespan is caused by an infection being brought about by an infectious agent. Okay, and its products, when you say products, it can be the toxins produced by that agent and transferred to other hosts. Okay, so that's why it's called communicable. Okay, and um, since this is communicable diseases, we are also going to add other terms like infection. Okay, infection refers to the presence and multiplication of microorganisms in the tissue of a host. Okay, and our topic is about communicable and infectious diseases, right? And there are two, to further explain those terms, there are additional terms which I'm going to present. Okay, when one is infectious and contagious. Okay, so as we have said, infectious diseases are diseases caused by an infection, by an infectious agent, and it can be, okay, there's an analogy here, there's an analysis here. It can be an it can be contagious and communicable, or it can be communicable but not contagious. Okay, so when you say um, communicable diseases, communicable diseases, um, or let's put it this way, not all communicable diseases are contagious. Okay, not all infectious agents or diseases are communicable. Okay, so the bottom line is, because there are some students, okay, confused that all communicable diseases or all infectious diseases are communicable, especially from one person to another. Okay, so not all infectious diseases are communicable. Okay, and not all communicable diseases are contagious. When you say contagious, it is easily transmitted. Okay, but all contagious diseases are infectious and communicable. Okay, so I know you get that, and you already had a very good foundation for it. Okay, so okay, just an additional term. Colonization is the presence of bacteria without multiplication and damage to the host tissue. Okay, so let us start with the discussion of communicable diseases, infectious diseases with this sort of review. Okay, because I believe this was discussed several times already in your fundamentals of nursing, microbiology, okay, and other sciences. Infectious diseases are known as your chain of infection. As we all know, there are six links to it. You have your causative agent, the reservoir, the port of exit from the reservoir, mode of transmission, then the port of entry, and the susceptible host. Okay, so let's review them um, separately. So first, we have the causative agent. This can be a bacteria, a virus, a fungi, a parasite, protozoa, and other microorganisms, okay, that can cause a disease. So they are considered to be pathogen. Okay, these are infectious. These are microorganisms which can cause diseases, right? So aside from the infectious agent itself, also the term can refer to a toxin or a chemical that is produced by that agent that can cause illness. Okay, so again, when you say pathogen, okay, these are microorganisms that are having the ability to produce diseases or infections. Okay, but uh, if there are pathogenic microorganisms, there are also non-pathogenic microorganisms. So when you say non-pathogenic, these are microorganisms that cannot cause disease. One example, also, although in some cases, okay, or most of the cases, are your normal flora, your resident microflora. These are microorganism that are microorganisms that are frequently encountered or found in everyone in a specific body part, okay, and they do not, okay, commonly cause disease. Okay, usually tears would see it can only bring about diseases when you're immunocompromised. Okay, so there are characteristics of causative agents. Um, One is pathogenicity, virulence, and effective dose. So when you say pathogenicity of a causative agent, this refers to the ability of an organism to cause disease. Okay, the ability to cause a disease. And then next is virulence or virulence. It's the degree of damage, okay, or the severity of the disease being produced, okay, to its host. Then infective dose is the amount or other references would say number of the pathogen that is required to establish an infection, okay, to to produce a disease. Okay, so for example, if you need maybe 10,000 of this agent to produce this type of disease, that's the infective dose. So meaning if that microorganism A is only 50%, or let's say 20, only 1,000 out of 10,000, it will not cause a disease. So that is infective dose. Others are other terms related for the characteristics are viability, cost specificity, and antigenic variation. So when you say viability, it's the ability of the organism to survive, okay, being alive in the environment or in the host. Okay, so the strongest survive, and the strongest causes infection. Okay, host specificity is the ability of organism to infect specific animal host. Okay, so specified to a certain host, just like viruses. Okay, they can infect men or man, I should say humans, but they cannot infect, okay, this type of animals. They cannot cause disease to this type of animals. Okay, so that's host specificity. Specificity. Okay. Then we have here is um, resistance. Okay. Invasiveness. Okay. And resistance, the ability of the microorganism to develop resistance to antimicrobials or drugs against them through molecular changes or mutation. Okay, we'll be discussing that later when we are going to discuss the diseases already. Then invasiveness, ability of microorganism to breach natural barriers like your skin, okay, and other defense mechanisms. So we can eliminate this link of the chain of infection by one, sterilizing surgical instruments or applying your knowledge and your skill on sterile techniques. Okay. What else? When it comes to food, good food safety methods, good preparation, good food handling. because there are diseases, infectious diseases from, you know, um, let's say contaminated food. Okay? Providing safe drinking water, what else? Vaccinating people, um, so they will not be carriers or reservoirs. Okay? And treat people who are ill to lessen the carriers and transmissions that can happen. Okay? Another um, this image of the chain of infection and additional knowledge being presented here. Okay, and anyway, we are going to discuss this in this slide, this presentation. Okay, next link is the reservoir. Okay, so when you say reservoir, it's a source of a causative agent or cause of causative agents, and this is actually not only to humans but human animals and fomites can also be reservoirs, and also environment, like water. Okay? These are actually any person, animal, plant, environment, objects or substance in which the causative agent can live and multiply. Okay, and it depends on its survival or its viability and its rate of reproduction. uh, Such number of microorganisms can be transmitted to a susceptible host. Okay, so that is a reservoir. Again, it can be human. Even though you are asymptomatic as presented, you can still be a reservoir, you can still be a carrier, meaning you can still transmit, okay, the disease. And we are being uh, what's this taught with this term carrier. Okay, asymptomatic. What else? Asymptomatic because of the pandemic that we're having, right? This COVID-19. There are people who are cases, frank cases. There are symptomatic cases. There are symptomatic cases. There are people who are carriers but do not manifest the signs and symptoms. Okay. So another image of the chain of infection. Okay. The next, the portal of exit. Okay. This is the means by which the agent leaves the original host or the reservoir. Okay. And um, the portal of exit, okay, especially if it's from humans, is related to the different systems of the body. Okay, the microorganism from a host, okay, from the carrier, okay, from the reservoir, if human reservoir, can um, exit, can leave that original host by respiratory system, sneezing, coughing, GI through feces, example, and GU through urine and other ways, lesions, blood, mechanical means through insect bites. Okay, so these insect bites has some theories, concepts would say, um, if you are being bitten, right, by an infected insect, okay, who is a carrier, who can be a carrier. Okay, so a person is infected, his bloodstream is infected, then an uninfected insect like a mosquito will bite or have bitten that person, infected person, the insect becomes infected. Okay, so uh, it's kind of weird, it's confusing. Okay, and the way the causative agent gets out of the reservoir, okay, is also likened to the systems. It's attributed to the different systems, and it's also said that it's also the way of portal of entry, which we are going to discuss next two links. Okay, so how can we reduce risk from portal of exit? One is covering when you cough or sneeze. So just like COVID-19, it's respiratory in nature. Handling body fluids with gloves, then doing hand hygiene, keeping your drain wounds covered with dressing, and not working when you have these signs and symptoms. Okay, so or what else? If you are also immunocompromised, that's also important for you not to be infected. But we're talking about portal of exit here. Okay, so if you have wounds, for example, you have cuts, you have lesions, you protect it so that microorganisms will not enter your body through these cuts, lesions, or wounds. Then we have the mode of transmission. Okay, this mechanism or the way by which the organism moves from the port of exit from that infected person or to that reservoir, or it's an environmental reservoir through a susceptible host portal of entry. So this is any mechanism by which a pathogen is spread from source or reservoir to a person, and to assist. This is the link of the infectious process considered to be the weakest, or in others, this is the weakest link. This means that when you know the mode of infection, mode of transmission of the disease, you, you can prevent it from further transmission. Okay, if you know that it is transmitted by droplet, if you know how to prevent that from happening, the chain of infection is cut. Okay, so that's why we are always taught on how a disease is being transmitted. Okay, because that's the easiest, that's the weakest link of the chain of infection, and hopefully we cut, we decrease, or we eliminate the transmission process. Okay, and lesser people will be infected until such time we eliminate the infectious disease. Okay, again, mode of transmission is the weakest link on the chain of infection. So there are four modes of transmission. First, we have your contact transmission. It can be direct contact from man to man, indirect contact from man or from inanimate object to man, and also droplet infection. Okay, so this is a person-to-person transmission of an agent by physical contact, okay, between the source and another susceptible host. So when you say indirect object or contact, there's no intermediate object involved. Okay, so from if man to man, uh, examples are touching, sexual contact, kissing, prolonged skin to skin contact, and when you say indirect contact transmission, um, it has a source, then it came a contact with a non-living object, then from a non-living object a person is infected. Okay, so that is indirect contact. So we're talking about the presence of non-living things, non-living objects, or your fomites. Then letter B is vehicles. These are spread through a common reservoir. They can be contaminated food, water, drugs, or blood. Remember that it should bear the term contaminated. Okay? Because, example, not food are contaminated, so there's no transmission. There's no presence of a reservoir. Okay? It's likened to a mosquito. Not all mosquitoes carry dengue virus. Okay? Airborne transmission, this is usually droplet nuclei, dust particles, organisms from the reservoir which are very minute or very tiny that we cannot see through naked eye, and they can suspend more time, okay, in the air compared to the droplet being mentioned in your previous slide, which is direct transmission. Okay, so that droplet from the direct transmission is larger, like the saliva. Okay, um, um, they have, when I say larger, they're larger in size. They cannot suspend in the air. Some references would say they can go as far as 3 feet. Okay, so that's why uh, in today's pandemic, there's a certain distance, okay, as from us to apply or to practice, because that's one way of preventing the transmission of disease if it's transmitted through um, droplet. Okay, so that's the difference between your airborne droplet and your direct droplets, direct contact droplets. Then we have your vector bornes. Okay, sorry. For vector borne, this via contamination or infected arthropods, contaminated arthropods or infected arthropods. Okay, insects. It's like the mosquitoes, flies, okay, snails. Okay. So how do we eliminate the mode of transmission? Very basic practice is hand hygiene. Wash hands regularly as possible. Wearing gloves um, to minimize contamination of hands, and discarding them after each patient. Usually, gloves are being recommended for health practitioners. Okay. Um, what else? Cleaning, disinfection, sterilization of equipment and the environment, and also of the person, infected person, and those public places or frequently touched objects should be cleaned also. Then if it's a vector, destroy, okay, the breeding site. Okay, then next of the infectious process is the mode of entry. Okay, mode of entry. This is the means by which the agent enters the host. So as I've mentioned earlier, usually the mode of exit, the port of exit, and the portal of entry is alike in terms of the systems. Okay, if the disease is having a port of exit from reservoir, which is respiratory, okay, likewise that's also the mode of entry. Okay, so for example, the suspended air droplets which came from a respiratory sneeze or cough, you can that particles, that microorganism can enter your body, can have that mode of entry by respiration also, by respiratory system. Okay, when you inhale it, as an example. Okay, GI, how? Example is a um, oral fecal route. Okay, so oral fecal. Okay, so oral anal route in terms of the GI system. How? Okay, when an infected person have moved and didn't wash his hands, okay, prepared food, then you ate that food that's possibly contaminated from an infected person. So that's the mode of entry. Then what else? Examples, okay, of possible mode of entry is breaking the skin. Okay, so um, the um, this not intact skin. Okay, so the infectious agent can get inside the body, also by mouth, by nose, by the eyes. Uh, what else? So we should protect, okay, our or the portals of entry of our own selves and or of the patients, especially those who are in reverse isolation. Okay, so dress the wound if they have. These are examples. You can dress their wounds. Um, the IV site is also properly taken care of. Eliminate the tubings as early as possible because this can be a site of infection. Wear masks, um, goggles, face shields. You know, um, what else? Keeping unwashed hands from your mouth. Okay, and food and water safety. These are examples of mode of entry prevention, mode of entry that's infectious process link prevention. Okay, then the last of the link of infectious process is the host. Okay, a host is a person or animal lacking resistance from a particular infectious agent, and he can be susceptible. Okay, so when you say susceptible, a person who has the higher chance of getting infected. Okay, one factor is, or we have two sets of factors here. One is said to be intrinsic factor, and the other one is the extrinsic. Okay, when you say intrinsic factors, these are risk factors putting a person at risk. Okay, a higher rate of getting infected. Like there are some diseases which gets higher in terms of age of a person, gender, genetics, occupation, nutritional status, blood status, underlying disease, comorbidity, or environmental factors, your immunity, your resistance. Once it's decreased, the higher chance that you get disease. Then current medications. Some medications have the effect of immunosuppression. So you are also cautioned to take care of yourselves because you have low immunity or immune system because of that disease. Okay. Um, what else? Oh, before I forget, um, in since we are in the host link, uh, again, when you say carrier, okay, a carrier is a person with inapparent or no signs of infection and or no manifestations of the infection, but is capable of carrying or transmitting, I should say, transmitting the pathogen to others. Okay, so the person can be said asymptomatic. Okay, even healthy persons can be carriers. So these are persons who never experience signs and symptoms despite having the infection. Okay, so that is a carrier. When we say asymptomatic, persons again without manifestations. So host factors, intrinsic ones, having devices attached to them, having invasive procedures done to them. One very good example here and commonly written on references is your indwelling Foley catheters or your urinary catheters. These urinary catheters put a person, a patient, um, having it on urinary tract infections. So they are prone to urinary tract infections. So how do we minimize the risks to susceptible host? Okay, one is vaccination um, before they be exposed, preventing new exposure, okay, to infection in people who are already ill. So this present illness may cause them to be immunocompromised. Okay? Then maintaining good nutrition, so more on your healthy lifestyle. Maintaining good skin condition because the skin is the first line of defense. maintaining what's this? Good rest and balance aside from nutrition. Um, what else? Covering skin breaks if you have. So using a protective barriers. Okay, so that is the infectious process or the chain of infection. So let's review some related terms here. When you say symptoms, these are evidence of disease that is experienced or perceived uh, by the person himself. Okay, these are subjective ones and they are not seen by a um, observer or examiner. On the other hand, when you say signs, these are objective evidence which can be observed, which can be examined by another person or the examiner or the physician. Syndrome is a specific group of signs and symptoms that accompany a particular disease. Okay. Incidence is the number of people in a particular population who develop a disease during a particular time period. Okay. Um, in in contrast, when you say prevalence, this includes cases from old and new uh, cases. Okay, this refers to both old and new cases. Usually, when you say incidents, these are the new cases, newer cases. Okay. So another set of terms, related terms, classification of infectious diseases based on behavior within the host. Infectious and contagious, we have mentioned this earlier. When you say infectious, any disease caused by invasion and multiplication of microorganisms or caused by an infection. Contagious disease are diseases that are easily spread, okay, or transmitted, or transferred from one person to another. The word that there is easy transmitted. Okay. Based on occurrence of disease, we have four occurrences of disease: sporadic, endemic, epidemic, and pandemic. So when you say sporadic disease, these are diseases occurs only occasionally. These are seasonal diseases. These are on and off diseases. Okay. When you say endemic, um, these are constantly present in a population. Okay, it's continuous. Okay, population, country, or community. Okay, just like malaria, okay, dengue in some tropic areas, tropic countries or provinces. Okay, epidemic, acquire disease in a relative short period of time, uh, but greater than normal number of cases. Okay, in an area with a short period of time. So, meaning if you have a casual number of disease A, but during this time, from a normal number of 30 cases in a month, it spikes up to, let's say, 100. So that is an epidemic. Okay, unusual number of cases. Then pandemic, uh, this is very popular again because of COVID. These are diseases that occurs worldwide. Okay, so those are the four classifications of infectious disease: sporadic, endemic, epidemic, and pandemic. Based on severity or duration of disease, we have acute and chronic. When you say acute diseases, these are diseases which rapidly develop but last only a short time, like measles, mumps, influenza. Usually, these are only days. Okay. For chronic diseases, develop slowly, milder but longer lasting clinical manifestations. Okay. Can go months, can go even years, okay, for chronic diseases. Based on state of host resistance, primary infection, secondary infection, and your incubation and your stages of diseases also. So when you say primary infection, these are acute infection that is caused that causes the initial illness. Okay? But on the other hand, when you say secondary infection, one caused by an opportunistic pathogen. Okay? After primary infection has weakened the body's defenses. So this is what I was referring to. Okay? The secondary infection attacks. Okay? The secondary infection happens if the immune system of a person is decreased, brought about by a former infection or a former disease. Okay, so that is a secondary infection. So we have here, I think this is already the different stages of sorry stages of the disease. One is incubation period. This is the time interval between the initial infection and the first appearance of any signs and symptoms. That's what you call incubation period. Okay, the time interval between the initial infection or the exposure to an infection, okay, and the first appearance of any signs and symptoms. Okay, so it's a period. Okay, it's an interval between your initial infection or exposure and the first appearance of any signs and symptoms. So, um, says sometimes as a basis also of the um, this is quarantine time. Okay, the incubation period, the longest incubation period. Okay, then we have another uh, for the stages of disease. We have prodromal period. This is the early uh, mild symptoms of disease is happening. Then the period of illness. Uh, this is where the signs and symptoms and the pathogenic infectious manifestations usually occur or appear, and this can, if not treated, manage the earliest possible time or the best possible way. uh, the person or the patient can die from the disease. Okay, if the immune system cannot respond properly or interventions are not effective. Okay, so the person can die. And also it depends on the prognosis, of course, of the disease in of the person in relation to the disease, because I believe now the doctors are really studying very well. Science have developed several times, have evolved several times, and it can predict prognosis. Then we have the last two of the stages of disease: period of decline. If the person is going okay, okay, getting better, the signs and symptoms usually subside, okay, but still the person is vulnerable for or to secondary infection. Okay, then if the person gets better and better and the signs and symptoms disappear, okay, it continues to the period of convalescence. So here, recovery is happening. Okay, the person regains his strength and the body returns to its pre-disease state. Okay, so I think to end this first part of this video lecture, we are going to have this overview of assessment in the control and management of the infectious disease. So what do we do in if ever there are infectious diseases, endemics? Okay, what do we have to keep in mind, or even just one patient to have infectious disease? Okay, so first, let's learn the history, know the history of the patient. Okay, presence of the infection, is it local or systemic? Uh, as the history of travel, okay, very relevant to our situation right now. Contact with animals or their products, animal bite or exposure to birds, or any way that he was exposed to a carrier or a reservoir? Is the person immunocompromised? Is the person vaccinated? Um, so those are usually asked. Aside from the questions asked, the manifestations based on your knowledge, is there really an infection? If not sure, maybe you have to consult or refer the person to a physician. Okay, you look for the signs and symptoms. If whatever you want to find out, okay? Or if you have sus, uh, some initial suspects of a case, especially if you're living in a place where there's endemic disease, okay, or there's a pandemic, for example, right now in COVID, okay, obtain specimen if you can, or actually this is in general approach, okay, obtain specimen, carry out specific tests, diagnostic tests, laboratory tests, which is relevant to rule out or to have a final diagnosis. Then, as a nurse, we all know, as a future nurse, we are asked to have this nursing diagnosis. So these are some links, or I mean some diagnosis which we can formulate depending on the situation, need, problem of the patient. Okay, so implementations and planning and implementations, possible implementations are uh, the treatment plan, okay, and it should be a team approach, okay. So of course the planning should lead to a better state of the person, a normal state or pre-disease state of the person, okay. So you do some interventions, actions to correct it, and to relieve the signs and symptoms of the infection, to overcome the immunosuppression being brought about by the infection, and hoping also the person can learn and apply coping mechanisms against the infection or the disease, the effects of the disease. Okay, so this is already mentioned earlier. Okay, measures to prevent spread of infection to others: wash your hands, uh, plan your date, your task to minimize exposure to patients. Okay, plan with the patient, especially if you're in the hospital, to prevent cross contamination from one patient to another. Then carry out isolation precaution, especially if the person is said to be immunocompromised. So you may practice reverse isolation. You're going to separate the patient, you're going to isolate the patient because he or she might be, or she might catch the disease. Okay? Observe asepsis as indicated. Use high efficiency disposable mask. Okay? Use gowns, gloves, handle needle syringes with extreme care, discard and handle waste with all precautions, handle bed diners and fomites with care. So this one is really more of um, a healthcare setting. Although you can also do this at your homes if you're with an infected person. Carry out current disinfection of fomites or the surroundings environment. Control dissemination of infectious droplets. Okay. Um, the dust particles is also considered. Ventilate rooms properly. What else? Okay. For immunosuppressed patients, use meticulous hand washing techniques before each patient contact as well as between patient care activities, just like what you have mentioned. This is to prevent cross contamination. Okay, going to that immunocompromised patient. Okay, emphasize hand washing. Then also give prompt attention to fever of that infectious, of that immunocompromised patient, because that would be a sign of an impending problem. Okay, we know that a fever is a sign that there is something wrong. Use private room, okay, for the immunocompromised, or isolation room for the uh, patient. Do not use invasive devices unless absolutely necessary, uh, and highly emphasize aseptic technique or surgical technique. Teach the patient and the family members about hygiene, okay, and signs of infection, when to report it. Time is of the essence, so you need to report it as early as possible. Okay, bath or uh, patients with antiseptic solutions, paying special attention to perineal and axillary area, because that's uh, where infection usually can grow. Okay, give attention to proper housekeeping procedures, offer low microbial foods and beverages when indicated, be aware of patient's emotional state also. Then we have two terms here, um, before we end for this first part. Isolation. Okay, first, isolation is the separation of persons suffering from a communicable disease, or of a carrier or carriers of the infected microorganism from other person or group of people, um, placing them in a direct or indirect transmission to susceptible person is prevented. So you need to isolate the person because they're the one uh, carrying the disease, they're the one transmitting the disease. Okay, that's usually strict isolation, and there are isolations related to systems. Example, you have your respiratory isolation. Okay, you have your enteric isolation for GI. Okay, then isolation also is the separation of sick people with a contagious disease or communicable disease from people who are not sick. Okay, this is coming from the Centers for Disease Control and Prevention. Okay, then we have your reverse isolation. I place it there. Again, this is to um, separate the patient who is considered to be immunocompromised, because he or she is the one who is high risk of having the disease or being infected. So, um, putting the immunocompromised person at risk of having secondary infections, okay, and considering that the person is immunocompromised. Then quarantine, I also place this on. Quarantine is the separation and restriction of the movement of a person or group of people who were exposed to a contagious or communicable disease, to see if they become sick. Okay, so they will be looking at the first signs and symptoms of the uh, disease that's related to a contagious or a pandemic, just like what is being experienced right now, quarantine. Okay, so that's all for the first part of this video lecture series. I know it's very lengthy, and we have more videos to come. And I hope you stay tuned on this video lecture series. And I hope somehow I have helped you with your current knowledge of the diseases. And if there are comments, if there are insights, you can write it down in your comments on the comment section, and I'll be glad to read it and respond to it. So again, God bless future nurses. God bless our frontliners, and hope to see you in the next video lecture of this playlist of this series. Again, this is Sir Juan, your online nurse educator. Be the best, be the best, and be the best nurse that you can be. Anyway, see you.